Hi everybody, I'm Sally Shen, and then I'm going to introduce about history of virus and the role of information. So for the contents, I will start with the introduction and then the first course, history of virus, about the cause and effects, major diseases, about the types of diseases and the methods to get of diseases, and the current situation of healthcare and COVID-19. For the second course, I'll introduce about role of information, which is mostly about infodemic, press, and COVID-19 and infodemics impact toward diseases. And for the last part, I will introduce about the solution for the infodemic and its conclusion. So for the introduction, diseases have existed together with humans from the beginning of the era, and they spread around the world through migration or by the animals or plants. For the information for those diseases in current time, people are able to easily access information through physically or digitally. However, some of the information may be false, which is related to the infodemic. So for the first course, I will introduce about the history of virus, how diseases affect people and its cause. Virus spread through migration of people or by animals through ships. For example, during the Columbus exchange, European trade with Native Americans, and from human or by animals such as rats, they spread smallpox to the Native Americans, and that about 90% of the Native Americans population was affected by Europeans. It's because of the Native Americans were not like fully immune to the smallpox, which Europeans mostly had. And for the causes of the disease, there's like first climate change, which is related to the water and pollution. Secondly, environmental factors such as food supply or water supply too. For the third one, disasters, flooding, earthquakes, or other like tornadoes. And for the first one, chemical, this is like related to the like human resources too, like toxic or pollutions too. For the major diseases, I just eliminate some of those because comparing for the death toll or the current time. For the first one, the first introduced was Antonin plague, which was the time period was 165 to 180, and the death toll was about 5 million. And when you compare for the death toll, the biggest was the Baptist, and it had about 200 million of the death toll, which was about half of the Europe population. And the next one was Spanish flu, which was the death toll about 40 to 50 million, and it was spread by the pigs or H1N1 virus. And for the current diseases, there were COVID-19, which started from 2019 and is currently going on. And the reason of the COVID-19 spread is COVID-19 was unknown, but there's like possibilities for pangolins, and the death toll is about 2.7 million, but it's still current right now. For the types of disease, I'll introduce about epidemic, pandemic, and endemic. For the epidemic, is about an increase of sudden in the number of cases of the disease above what is normally expected in that area, in the small area. And for the examples of epidemic diseases, they are yellow flu, smallpox, measles, and polio. For the second type, Secondly, there are pandemic, which is an epidemic disease that has spread over several countries or continents, usually affecting a large number of people. For example, COVID-19 is also called the COVID-19 pandemic, which is spread all over which is spread like various in the countries too. And for the last type of disease, the endemic disease, that it is a type of disease that outbreak that is constantly present but limited to a particular region. And the endemic diseases are different from other diseases because it is predictable. It is predictable for a spread and rates that is able to control. For example, there's malaria. So for the methods for the diseases, firstly there are disease control and then an elimination, and lastly there are eradication. The disease control is reduction of disease incidence, prevalence, morbidity, or mortality to a locally acceptable level that is able to control the risk of the spread of disease. And for example, there are diarrheal diseases. For the elimination, it is the most hard message to get a disease because it is to reduce to zero of the incidence. And for example, there are not called tetanus for the elimination. And lastly, for the eradication, it is a permanent reduction to zero of the worldwide incidence of infection caused by specific agent as a result of deliverable efforts. And for the example, they are smallpox. About the current situation of healthcare in COVID-19, I brought the map or the scale over here, and it says the darkest is about 84.2% of the doctors or medical workers in that era. And according to the map, in Asia, like in Russia or Australia, they're like about 84.2, but in areas such in countries which is located in Africa, normally they're not available or has a really low rate of healthcare. And for the second course, I'll introduce about the role of information. And I will talk mostly about infodemic because it is mostly related to diseases. The definition of infodemic is too much information, including false or missing information. This includes both physically or the digital information too, and it causes confusion and risk-taking behavior that the people cannot believe the press so much if there's so much infodemic information. And it is an information that can spread rapidly because of the development of technology. For the cooperation between the countries, 132 countries signed cross-regional statement on COVID-19 epidemic, and the picture next to it is the list of the countries which signed for the statement. For the second one, for the press and COVID-19, I will introduce about the reasons why epidemic had occurred. Firstly is the pressure of journals that as scientists rush for the research of coronavirus, the journal number of published papers had increased. According to Java, about 300% of information had increased due to the coronavirus. For the second reason, there is pressure on scientists that the rapid increased number of papers and it didn't ensure its qualities. Lastly, there is pressure on public that the people has full ask so much question and force answer toward the scientists and policymaker that it affects both the journalists and scientists to rush over to find information which is not qualified so much. And this is a scale about the epidemic's impact toward diseases. So as the color becomes red, the rate of epidemic has increased. That in least development countries, they're like less epidemic because of the access to information. But in the countries such as United States, China, or other countries, other developed countries has a high rate of epidemic. For the second scale right here, the graph over here introduced the number of epidemic that the conspiracy theory, rumor, and stigma is all of the epidemic. And as the times go on, we can see the trend that number of epidemic is increasing. So for this solution, according to Tedros, the Director General of WHO, he said that we're not just fighting an epidemic, we're fighting an epidemic, which he stays the battle against epidemic, and it also includes the cybersecurity in search for the epidemic. And for the second solution, there are cooperations between countries that WHO manages the member states to take measure of the misinformation or disinformation. And this is the member states is the 132 countries which signed for the statement as I introduced during the epidemic. And for the conclusion, diseases had existed with humans since the beginning. As the medical technology developed and healthcare is improved in countries, the number of epidemics increased too. The epidemic is harmful toward people with little amount of information in diseases and the healthcare. To overcome those misleading information, support or corroboration between all these developing countries and developing countries are necessary, and people should be more educated how to discover them. Thank you.